couple, like, we know what braces look like. This, to correct an overbite, we use something called a bite turbo. You will probably see this. It will probably interfere with whatever you're doing. I don't know Jennifer one, but I'm sure, I don't know how she deals with this when patients have these on. But this, like, when you have a deep overbite, the upper teeth, if you don't have something stopping the bite, at least at first until the teeth are straight, your upper teeth are going to knock off your lower braces. So Jennifer, I don't know, like, in terms of our referrals to you during braces, if someone has these bite turbos, do you prefer them to be off before we work with them, or do they get in the way of what you're
yes,
doing?
I don't, it depends on how, they can still get up to their ridge, right? And the purpose of them is not to let the teeth hit this way, right?
Yeah, usually
So-
by the time I'm sending to you, they're done with
I
it.
feel like
These are,
I
the first
rarely
time.
see them on there, but I know people use them. They don't really get in the way of what we're doing. I don't, maybe for production of speech sounds. I think they're actually okay on there. I'm trying to think of if I've treated anybody with them on there. Only a couple times, and they haven't bothered me, because I can still get exactly where I need to go behind it. I mean, if I used to think, like, are those there as kind of like a inhibitor of the tongue, to prevent the tongue from coming forward? That's what I originally thought they were, like a gazillion years ago.
Spur.
Yeah, like a spur, exactly. But no, we can work around those, for sure.
Usually this is done in like the first half of treatment, and usually we're sending the myofunctional therapist in the second half of treatment when we're trying to work on the bite.
Mm-hmm.
This is Invisalign. I have lots of patients, especially relapse patients, that Jennifer has worked with while they're in Invisalign.
And now they do Invisalign, so I just wanted you to say, now they're like in the mall.
Yeah, just,
Yeah,
right.
just
put them in
So I
our
just
order.
think it's worth it for you to say, like, it's not an orthodontist helping with any piece of that puzzle, with the people who go to the mall and they like get their scan and they like get their
No.
Invisalign. Or people who buy things online, on Facebook, like I think
all bad.
it's all bad.
All the other ones hate it.
Yeah.
But it's true
Because they don't do your bite.
Right. All they can do is like straighten your teeth a little bit more. I mean, there's a lot of reasons why that's not advisable. So
Beware.
yeah. But it's funny because now they're starting to advertise Invisalign for young kids, and I showed you. Everyone at our office has seen it. The pamphlet they sent out as the advertisement to all dentists and all orthodontists. The kid on the front, I should have brought it. He's like this.
Yeah, he has a total tongue
A
thrust. It's
major.
hilarious.
Wow.
The kid's wearing an Invisalign tray, he's like this. It's really funny. I mean, it's not funny for him, but.
But when you use Invisalign, you can put the hooks and you can actually use bands and you can close off.
Right, like there's tons of things now that orthodontists are doing with Invisalign. You can treat all sorts of cases with it. So, right, it's becoming as ubiquitous almost as braces. So you will have patients in both. So we talked about this a little bit already, but a typical referral pattern, just historically what we've done. We've seen them for an orthodontic consultation. We've done phase 1 treatment, then we sent for the myofunctional. But we're saying now that maybe it'd be beneficial to get in before then.
Some early intervention, take a break, and then get back in.
So I guess like having this kind of protocol, like what you prefer when you go in to meet with an orthodontist, to kind of tell people what you do, be like, this is kind of how I like to do things. If you notice someone that has an issue, work with them a little bit, you do your thing, I work with them more, and then that's kind of a good protocol. But this is really like the bread and butter of what you're going to be doing with orthodontists is helping them in the final stages of treatment to when a tongue thrust becomes evident, to finish the case and or prevent the relapse. So that's what Jennifer's done for us orthodontically, historically, most of the time, is working with the teenagers who are in full braces, getting them where they need to go.
Yeah, I think there's like the patients that it's so very obvious they were long-term thumb suckers, they have big open anterior bites, they're like the severe tongue thrusters. These are the kids that have been in speech forever. I mean, they're classic. But then there's this whole other host of people, these adolescents, that it's like they don't notice it until so mild, or they might have had speech when they were younger, not addressing the underlying issue, and so it's mild enough that it's kind of sneaked under the radar until they get to that stage.
I mean, we've had people that have very, very minor issues, but it's enough to cause
A relapse.
this after 6 months, bite opening. We had to retreat her. And after 3 months, this. So no parent, no orthodontist, no patient is going to be happy after they've had 2 phases of orthodontics, take off the braces and their teeth look great, and then 3 months you're like, oh. So, I mean, yeah. But I really think that what you provide is such a huge resource for us as orthodontists, and the buy-in from orthodontists especially, I think that it's only going to increase over time, and what I hear on, I'm on part of this Facebook group where there's a lot of posts about all sorts of orthodontic topics, is that there is need for orthodontic myofunctional therapists, but a lot of people just don't have access to them. It is just amazing to have someone that comes into our office, because now kids are so overscheduled. You can give them a card and say your teeth are going to relapse, but there's so many people lost in that shuffle. If you can actually be there to do your consult and meet the patient while they're there for their orthodontic visit, the conversion rate for you is amazing, and you're doing a huge service to an orthodontist. And if you're doing it at one orthodontist office, a lot of orthodontists talk on Facebook, on study clubs, you tell another one, and I think that's like a really good way to get your foot in the door. Any questions?
I know you guys you're gonna go to lunch and you're gonna have a gazillion questions. Like you're gonna be thinking about, questions that you're gonna want to ask. And the good news is that you guys are gonna be here throughout the weekend.
Yeah.
So for some of the time, right?
Right, and I'm happy to answer any emails. I'll have Jennifer give you my email address and my presentation.
Yeah. And even throughout the rest of the seminar, if questions come up, just shout them out. And if they're not here, or if I can't answer it, then we'll write them down and make sure that we get the answers for you. But to me, I'm so grateful that you guys are here, because it's one thing for me to talk from a speech therapist perspective, but once I started, now every time I do a seminar, I bring an orthodontist, or I try to get an oral surgeon, or I try to get an ENT. I try to get professionals that are part of the team, because I know that it makes everything more credible, but it also shows that this teamwork approach works. It's effective for our patients. It's helpful to every professional that's involved in that patient's care. So I'm so grateful to you guys. I just think how it solidifies everything that we talk about, and thank you guys so much. Thank you.
Do you want to see
Thanks.
the stats? I have them in my email.
Yeah, I think,
I don't know how to access them.
oh, you want me to, in your,
You
it's
want to see?
a cephalographic x-ray?
Yeah, I can just show you, and then you can see.
So all orthodontists do a different assessment and kind of do things differently, right?
That's pretty standard, standard.
Yeah. Dr. Sheehan, do I need to do this? I think I need to do this. It knocks me off every few hours, can you tell? So then we just have to go back in.